So HealthCall Live is happy to welcome to the microphone Robert Harrison, a doctor of physical therapy at Steppin Physical Therapy. Thanks for joining us this morning.
It's a pleasure to be here.
So how do I figure out the cause of my back pain?
Right, so there's sort of two different reasons that you'd have back pain. You'd have back pain from either muscle or a nerve. Okay, and the muscle pain can kind of be acute, or it can be chronic, meaning it can happen over a weekend. So if you're overdoing it, you're out in the garden a little too long, things like that, and you start to feel like your back's getting sore, you might have overdone it. That's where you have acute pain.
Okay.
And then you have kind of chronic back pain, and that's where you've had this pain for a while and it's kind of ongoing. It just seems to get worse and worse and worse.
So we'll talk a little bit more about the anatomy and where all that comes from. Is there something about the way the pain feels or the nature of the pain that tells me whether it's muscle or nerve?
Oh, absolutely. There's a sharp shooting pain, or kind of like a lightning bolt pain, and that's going to be more your nerve pain. Radicular pain is kind of what we refer it to as. And then there's kind of this hot or this burning, maybe just like a tight pain, and that'd be more indicative of a muscle.
So when I feel that lightning bolt or that burning pain, obviously stop doing what I'm doing is the answer. But then what then? What's the immediate step I should be taking?
Sure. So you obviously, like you said, you want to stop doing what you're doing, and you want to figure out a way to calm your back down. So what your body's telling you is that you're overdoing it, or you've got some like inflammation starting to happen, and you want to find a position that's comfortable for you, that's comfortable for your back, to where you're not feeling those symptoms anymore.
Makes sense. And then ice, heat, drugs. What's the appropriate thing to do?
Well, typically I try not to go straight to like opioids or things like that. If you I'm not a medical professional, or not a medical doctor, so I can't prescribe any medication for you. But heat or ice, whichever one helps you down. The ice is going to be sort of a numbing agent, and reduce the pain and the feeling in that area. Or if you're more of a heat guy and you want to put some heat on to try and relax those muscles, that'll work perfectly too.
Okay, so now let's get into some of the individual sort of anatomy issues. Muscles are more common than nerve, or is nerve more common than muscle pain?
I'd say it's about equal, but in terms of what we're seeing in the clinic, it's more related to that nerve pain. And so if we're talking about the spine, let's just kind of imagine we've got a stack of bricks, and in between each brick is sort of like a jelly donut, okay? And that jelly donut is going to be your disc. And so inside that donut is the jelly, obviously, and that is usually what's causing the problem, whether it's shooting out of the donut or it's just bulging out and things like that. And that's where we get into those terms of like a herniated disc or a bulging disc.
Yeah.
Right? So these are words that are used pretty commonly, but we don't really understand them. Degenerative disc disease is just as common as arthritis. It's just as common as getting gray hair when you're older. It's just something that tells us that we've lived a good life, okay? Now the problem is with a herniated disc or a bulging disc, and I think some people will use slip disc, okay?
Yeah.
So I'm saying these words quite a bit. Let's try and differentiate between the two. Now, a slip disc and a herniated disc are essentially the same thing. And that's when you have that jelly in that donut kind of squirting out to the side, and it's compressing on that nerve. And that's where you're starting to get that nerve pain. You might feel it in your back. It might shoot down the leg, all the way into the heel sometimes. And a bulging disc is where it doesn't actually exit the donut, so to speak, but it still pushes up on the nerve, so you might still have that pain. The intensity of it might just be a little bit different.
Okay. And those can be as a result of either movement or overuse, or it can just be degradation, as you said, just wear and tear, right?
Yeah, absolutely. And it's important when we see it in the clinic for us to try and figure out why that may be happening and what we can do to try and resolve that issue. Because there are different ways to make that jelly go back into the donut, and there are other options as well.
Discs are kind of weird in that they don't have a source of blood or nutrition on their own. They're not vascular.
Right.
So what can you do to help those guys repair?
A lot of times it's just, like I said, is correcting the movement and trying to get the disc to reform in the shape that we want it. And if that doesn't work, sometimes surgery is indicated. If the disc is herniated and it's kind of like oozing out onto the nerve and it's causing some sort of debilitating pain or movement dysfunction, or sometimes sensation is impaired, that might be an indication for surgery. Otherwise, what we want to try and do is push that jelly back into the donut, and there's a bunch of different ways that we can do that.
Oh, let's talk about that. Yeah, what are some of those? Because
Sure.
It seems odd that I can use exercise or movement to get that jelly donut, as you called it, back together.
Right. So if we're thinking about the spine as a couple of bricks, and then we think about the donut in between those two bricks, it could go either way. It could come out the front, it could ooze out the back or out the side. It really depends on the patient. So it's a case by case. So if it's oozing out the back, it might sound weird, but we want to kind of get more into an extension moment. So we want to bend our back a little bit to try and push that back in. There's a bunch of different methods that people will use. You can do manual techniques by pushing on the spine. You can use traction by kind of pulling those bricks apart, the vertebrae in our spine apart, to try and get that to go back together. A lot of times you'll see, and it's a pretty good indicator that it's like a posterior bulge or it's bulging out your backside, is if someone is in a flexed position all the time. So you see people at the grocery store, they're leaning over those carts, and that's the only way that they can get around to get their groceries and things like that. Well, it might be because they have a posterior bulging disc or even like a herniation.
So what do you do in that situation? So you're walking me through exercises or the traction component?
Yeah, so we're going to throw everything we can at you to try and get you better. And whether you're responding to exercises or a specific movement, and like I said, some people will have sort of a bias to be either in a flex position or an extended position. And what we want to do is see if we can centralize those symptoms. So if you have pain that's starting in your back and it's shooting all the way down your leg, we want to try certain things to try and get that pain to kind of come up the leg, come back up the knee, and go back to where it's actually originating from.
So Robert, we have covered anatomy. Now let's talk about what you're going to do to help me. So if I have the muscle-related type of back pain, what's the first step? How are you going to get me moving again?
Yeah, so as I mentioned before, we want to calm down those muscles because they're inflamed, they're upset. Something that we did, they didn't like it. So we got to figure out the position that we can put you in, and oftentimes that's what we like to refer to as a pelvic neutral. So laying on your back with your feet up and your knees kind of bent a little bit. A lot of people that have low back pain, and especially chronic back pain, they've found this position on their own just through trial and error. So you'll see people sometimes laying on the floor at home with their feet up on the couch, and that
Sure.
kind of relieves that pressure. And what that's doing is it's getting your spine in that neutral position, so it's nice and flat, and there's no pressure being added onto it from the pelvis or from weight on the shoulders or anything like that. So we'll get you in that position. Get the back nice and calm down. Sometimes what we want to do is get in like a quadruped position. So we're on all fours, hands and knees, and we're kind of rocking back, sitting our butt back on our heels. And what that does is that kind of stretches out the muscles in the back, our paraspinals that sometimes might be inflamed, and just starts to calm those down too. So those are two really quick fixes, I think, to just sort of calm down the pain and just get you to relax.
So obviously those are things that I can try and do at home if I need to. It sounds like those are pretty low risk.
Mm-hmm. Yeah, absolutely. Yeah.
Okay, so what's a more advanced step? So that's step one, to try and get those muscles calmed down. Then what? Because now you've got to strengthen the muscles, right?
Right, absolutely. And I tell people, if you're going to work and you're coming home and you're feeling sore, well, that's an indication that your muscles are weak. You should be able to get through a full day of work without being sore, even if it's a labor intensive. We've got a lot of blue collar workers around the area that are working factory jobs all day, and they're coming home and their aches and pains, and all they want to do is lay down. Well, unfortunately, and it's hard to say, it's a tough truth, but you've got to go and you've got to do a little bit more. You need to prepare your body to be able to do more than just your 9 to 5.
So You're telling me I need to lose weight, possibly. Probably more likely that that's the case, right?
Potentially. You definitely, losing weight is never a bad thing. There are countless things that it helps improve,
Sure.
Vascularity, things like that. But also it's going to de-weight the spine. So it's going to take the pressure off of those donuts that we talked about earlier, and it's going to help your body just be a little bit more.
So give me a couple of back strengthening exercises that I might be able to do.
Yeah, so oftentimes it's actually not the back that we need to strengthen, but it's the hips and it's the legs, because that's kind of what's carrying us. Or maybe it's the abdominals. So people, they tend to focus on where the pain is coming from, but that might not necessarily be the issue. You might be having back pain because your hips are weak. If you can, and I encourage people to try this at home, put your hands on the counter, okay, so that you're nice and steady and balanced, and see if you can stand on one leg without using your hands. Keep them there just in case, because I don't want anyone to fall at home.
Right.
But see if you can just stand on one leg for about 10 seconds. And if you can't do that, well, that's an indication that you've got weak hips. And that could mean that the whole thing down the chain is what's causing you. You might be walking funny, you might be waddling a little bit, and that might be what's kind of jarring your back.
Interesting. So my back pain is because my hips and legs are weak.
Sometimes your back pain can come from that. Sometimes it can come from weak abdominals. We have what's called a transverse abdominis, and that's kind of our corset, if you will. You see people, weightlifters especially, wear those big belts, and what that's doing is that's helping to keep compression on the spine as they're doing those heavy lifts. Well, if we don't have that strong transverse abdominis to keep that pressure off our spine when we're going through our day-to-day stuff, well, that's when you start to notice that pain.
So shoot me a couple of quick hip leg sort of exercises. What can I do?
Sure. So a common one is just to sit to stand. So everyone has a chair at home, right? Try and get up out of that chair without using your hands. If you can do that 10 times pretty easily, we'll move on to something else like lifting weights or squatting and things like that.
Gotcha. So how often should I be doing these exercises at home?
When I see patients in the clinic, I give them exercises to do twice a day. And usually it's like 3 sets of 10, because what we're going for is some sort of strength regimen. So you need to be exercising at least 30 to 45 minutes a day, or at least just, getting up and moving around.
What can I do for some of that disc-related pain that we talked about?
The disc-related pain is a little bit more complex, because that's going to be on a case-by-case basis. But if I was going to suggest anything to anyone, it would be to get up and go for a walk. That cyclical movement of bouncing up and down on that disc could potentially start to do what mechanical traction will do, which is pull the spine apart and push it back together, trying to get that jelly back in the donut.
So, but that hurts to walk. That's why I'm not walking.
Absolutely, and there's a lot of people out there who have experienced back pain. They found a comfortable position that they like to be in, and then they're stuck in that position, and they don't want to do anything else, or they can't do anything else because they're avoiding that pain in their lives. And sometimes, it's hard, but you've got to push through it a little bit, and that's where exercises guided by a medical professional are appropriate, because you want to know when I'm pushing it too much or when I'm pushing it not enough.
So if my diagnosis has been sciatica, talk to me about what's going on there and what can I do?
Yeah, absolutely. The sciatic nerve is kind of tricky, and it gets a lot of the flack for low back pain, and that's because the nerves actually come from the lumbar spine and a little bit of the sacrum. So a lot of people will say like L4, L5. You might be common in hearing that. So there's 5 lumbar vertebrae, and so the sciatic nerve actually comes in from out between those, and it shoots down our backside, and it comes out as sort of like a dime or a nickel-sized nerve all together. And if you Google a picture of the sciatic nerve, that's oftentimes where you'll see it being like explained in anatomy and things like that. And there's a lot of muscles in that area, and if you have tight muscles in the area, like a piriformis, it could be rubbing on the nerve, and it could be causing those radicular symptoms.
So I've got muscles that are tight and angry squeezing against the nerve. So I'm back again to exercise and moving those muscles.
Correct. And stretching and things like that, or a therapeutic massage, or what we call soft tissue mobilization. And then sometimes, we'll try trigger point dry needling.
Ooh, tell me more about that. What are you doing?
So trigger point dry needling is where we take a needle that is the same as acupuncture needles. We just go a little bit deeper, and it's just a little bit more evidence-based, if you you will. So we know the structures, we know the anatomy of the entire human body, and we know what muscles we're trying to hit. And we'll take that needle and kind of go down to the problem area and try and create a little bit of micro trauma, if you will. And what that does is it restarts the healing process. So people who have chronic back pain specifically, you'd like to try some trigger point dry needling with them because you want to start that healing process over again. You want to get them moving.
So I'm confused by that. So the muscle is tight, and you put a needle in it, and that does what?
Right. So the needle itself is going to cause some micro trauma, and it's going to increase blood flow to the area, which we all know blood flow is great, and what that's going to do is promote that healing process. It's going to start it over. When you have an inflamed muscle, that inflammatory process go on for so long, it comes from acute and starts turning into chronic.
Mm-hmm. Gotcha. You know what? I just glanced at the clock here. We're 26 minutes past the hour. We have just a couple more minutes with Robert. So if you have a question, I haven't given the phone number very often, but the phones are open at 447-1190. So jump on the phone and get in real quick because we just have a couple minutes left with Robert. I want to touch on something that I think is pretty interesting, and you have a special interest in prosthetics.
Yes, that's right.
Tell me more about that. How do you work with someone who has a prosthesis?
Right, so there's many different types of prosthetics. There's upper extremity and there's lower extremity. Being a physical therapist, we tend to treat the lower extremity more. You can have an above knee amputation, a below knee amputation, wherever that may be. My goal is to try and help you get back to what you were doing prior to losing that limb. So whether it's working on gait mechanics, going up and down stairs, or even some higher level amputees that want to get back to weightlifting or running and working out, and things like that.
Yeah. Diabetic amputations are such a huge problem and very prominent in this area.
Yeah.
I hadn't thought about that, but you have to learn to walk again, and that changes the entire dynamics of your gait.
Yeah, absolutely. And obviously the amputation takes away certain muscles, so you got to use muscles differently than you used to. If you have an above knee amputation, you don't really have the hamstrings anymore, so all you've got left are your glutes essentially. And so you got to figure out how you're going to do movements that are comfortable to you. That and believe it or not, amputees have low back pain too. Mm-hmm. So you got to be able to figure out comfortable ways to get up and get moving.
So I get it. So your special experience in that regard could be very helpful in helping me recover from that horrible situation.
Yeah, absolutely. And I'm specifically located at our Auburn Road location. Uh-huh. And through the course of my schooling and clinical rotations and things like that, I've worked with many amputees, and I enjoy doing it.
So in the last few seconds here we have, what didn't I ask you that you think is important for people to know about back pain?
I think it's important to, and we kind of addressed it. I guess I wouldn't say that you didn't ask me it, but it's important to get up and get moving. Develop some sort of exercise regimen or just some sort of walking program, whether it's walking after dinner or something like that. Get up and start moving again. Get off the couch and just do something a little bit active. I know we only have a few short months of this nice warm weather, right? So try and take advantage of it.
Yeah, that is so. But that's tough. I'm in pain. It's kind of a vicious cycle here. So you've got to provide enough gumption to get off the couch and get moving. That's your answer.
Right. So find a motivation, whether it's your grandkids or whether, it's your neighbor who thinks he's better than you or whatever. Try and find something that motivates you to get up and get moving.
All right. I appreciate that. Our guest is Robert Harrison, Doctor of Physical Therapy at Steppin Up Physical Therapy. You find them online at steppinupt.com. They have 4 locations in the Fort Wayne area. You can find the phone number to the location nearest you online. And Robert seems to be more headquartered at the Auburn Road location. If you want to be in touch with him, you can do that.